Hi, everyone. My name is Maria. I'm the chair of the FSEP Medical Student Council. I'm here with Dr. Gu from Tampa Bay EM. So if you'd like to introduce yourself and your program.
Absolutely. Well, thank you for having me. My name's Shayne. I am the program director for Florida's newest emergency medicine residency program, and that's at BayCare Health System, St. Joseph's Hospital in Tampa.
Nice. So just to get things started, what would be your favorite song currently?
That's a good one. It changes from week to week. I think Lady Gaga shocked everyone with Abracadabra. That's the new one. But my go-to forever and always is Almost Heaven. John Denver, West Virginia. Just being a native, that's something that everybody karaoke's to, and I always get like clips and pics of people singing.
Yeah, I love that. So then I guess going back into your program, super exciting that you guys have a new EM program. And I'm sure you have a lot to discuss with us about that, but we want to know what are some key highlights of the clinical training that students should expect when they go there?
Absolutely. I think probably the most exciting thing for me is the hospital itself, St. Joseph's. It's everything all under one roof. We're adult and pediatric trauma center, STEMI center, comprehensive stroke center. We have like super subspecialists. There's an LVAD clinic, so we get LVAD patients. And again, it's all under one roof, which has become less and less common in EM training. And I think it's one of the things we maybe take for granted. Even when I was in residency, you go to a couple different places and think, oh, where do I park? Where's the bathroom? Who are these people? Where's the cafeteria? Um, so none of those distractions. You spend the whole time under one roof at one hospital, where we have, again, a comprehensive training program.
Nice. Yeah, no, that's definitely nice to not have like rotations right now. I have to go to a bunch of places, so it's nice to have everything in one place. So then as a resident, what responsibilities will you guys expect from your residents as they progress through their training?
Yeah, we definitely have a graduated system for autonomy. And it's going to be a little different because, as you can figure out, this year we're only going to have a PGY1 class. So this class will really have the opportunity to kind of be the trendsetters and the chart coursers and set the culture for the program. But we're also not going to expect them to be, running the department on day one either. So we have a really fleshed out system where of course, you're going to be autonomous for your own patients, working one-on-one directly with an attending on each shift. But the expectations in terms of patient acuity, patient volume on your ED shifts will gradually increase throughout the 3 years. And of course, the senior resident having more of an supervisory role for the younger learners as well.
Nice. Yeah, no, I guess that's the perk of being a new program too. It's like the new class is the one that's really going to get to set that, standard as you're saying. Um,
Absolutely.
so then going off of the residents and their responsibilities, specifically the curriculum, how does your curriculum like give us a breakdown of it and then how it's going to balance with like didactic training as well?
Absolutely. So our clinical curriculum is, like I said, pretty comprehensive and hits all of the requirements for the ACGME. So you have the normal things you'd come to expect, MICU, PICU, trauma, all of those things. I think one thing that sets us a little bit apart from the rest is the dedicated pediatric experiences. So we do have a very strong PEDS emergency department with over 40,000 visits a year. And all of our attendings that work in the PEDS department are all fellowship trained in pediatric emergency medicine. So we actually do 5 dedicated blocks over the course of the 3 year period. And you also have longitudinal shifts, so 1 to 2 shifts each month that you're in the adult ED as well to keep up those skills. So we really want to, our residents to be prepared to take care of the sick child in any environment once they graduate, since that's something that a lot of graduates from across the country seem a little uncomfortable with when they get out on their own. The other thing, we have dedicated pediatric anesthesia and several ultrasound rotations. So you kind of get the basics in the beginning and then work up to those more advanced applications as you go on in training. As far as the didactic curriculum, we do an academic half day that is protected every Thursday morning. So no residents in the emergency department on Wednesday nights or Thursday mornings to really protect that educational time for us. We do use III, so there is some asynchronous component, but then again, a lot of interactive modalities for teaching in conference. So if you know anything about me, I am like gung-ho anti-lecture. I never want a faculty member to get up there and just talk for 30 minutes at you. So we really employ interactive modalities for learning, case-based, team-based, gamification's a big one. So things that, you got to learn this stuff anyway to pass the test, but why not have a little bit of fun while you're doing it?
Yeah, for sure. It's like, going through rotations right now, like coming home and having to study. I'm like, oh my gosh, I learned so much better just sitting in there with the attending and like discussing actual cases. So I feel like going into residency, it's important to have that balance as well.
Absolutely.
So then I know, speaking of like electives and stuff like that, how much elective time is built into the program? And then how flexible will the program be allowing residents to explore subspecialties within EM?
Yeah, we currently have two dedicated elective blocks, one in PGY 2 year and one in PGY 3 as well. So everybody's going to get that experience at a minimum. We are also exploring the possibility of replacing one of the pediatric blocks if somebody does have a really big passion for something that we need to be a little creative and structure for them. That's a possibility as well. The couple electives that we've already kind of set up and standardized are orthopedics, medical education, administration, observation medicine, which is a growing cool new thing. And we have what's called a STAT team. And this is like a team of interventionalists that respond to strokes, STEMIs, PEs. So they kind of get to see the patient in the emergency department, but also through their hospital course as well. Those are the ones that are set. Now, again, being new is really cool because we have the opportunity to create new rotations for people that do have a certain passion. So if I have a resident that says, hey, I really love sports medicine, and we don't currently have that set up, well, that's something I'd be excited to work with that resident and make elective opportunities for them.
Yeah, that sounds great. Again, it sounds like, the residents are going to have a lot of autonomy working with you guys to be able to make the program what they want it to be with you guys as well.
That's
So,
exactly what we're looking for.
yeah, no, that's awesome. See, really great. And then, so since the residents get to set it, but what do you as a PD look for as a successful resident in the program one day?
Yeah, I've been kind of telling people throughout this interview season here recently, what I'm really looking for is a good, hardworking, committed person, somebody that is passionate about emergency medicine and wants to kind of push the envelope and move the needle, not only locally in Tampa, but globally for emergency medicine across the country, across the world. So you know, certainly board scores and things like that matter, but they matter a lot less to me. I care more about your personality, your professionalism, your willingness to kind of go the extra mile and push yourself. Don't ever settle for just being average or meeting the status quo, but really elevating yourself beyond that and using this time and training to become the very best physician that you can be.
Yeah, for sure. And then, so again, it's just starting, but what are some of the things that you plan on doing to promote the wellness amongst your residents?
Yeah, so I think that's the most exciting part for me is getting to start. Every other program I've been a part of in my life, you come in and you have to kind of change the culture, which takes a little bit of extra time and resources and, putting yourself in there. Whereas now we kind of get to start from square one and build it exactly the way we want it. Um, I truly believe that wellness starts with the career. This is a job unlike any other. You're not just going in and punching in and out, right? This is a career, a calling, a passion. And to be well in your life, you have to be well at work. So no, pizza parties and going to yoga, whatever. Sure, we'll do those things to check the box. But what I'm really working more towards is developing dedicated mentorship pipelines so we can ensure that your career goals are kind of supported and met from day one. Again, making sure that on shift, the work is good for you, cutting out mundane tasks, really utilizing the time to get the most procedural experience and taking care of high acuity patients and not having to worry about, does the computer work or the EMR is not doing well for me, or I'm being asked to do tasks that maybe would be best left to another, a nurse or technician, somebody that's able to do that while we can focus on MD and DO oriented things. So that's really my passion. Certainly, we'll do the normal things. We're gonna have the pizza parties. We're gonna go kayak and take a park day and things like that. But we're really going to be focused primarily on building mentorship and making sure you're well at work, so you can also be well in life outside of work as well.
Yeah, for sure. And you guys are already in a great area. Tampa Bay is beautiful, so the wellness and all the outdoor stuff will come easily with you guys.
I always say I live where people vacation, so
Yeah, for sure. I
get
used to live in
it.
Clearwater, so it
Oh,
was like
yeah.
best weather all the time. And then so I guess going off of that, as students are watching this video, how can they, I know that you said what a successful resident looks like, but how can they stand out? And then also like when you guys start to do audition rotations for students one day, how can they, or like what are you going to look for them?
Absolutely. So I think again, the commitment to EM is probably the biggest thing for me. So, if you did a lot of rotations or were involved in your EMIG and, it really shines through in your application, that's great. I know a lot of times people don't really discover that passion until a little bit later in their training. So really making a point to call out how you got to that and why emergency medicine, to kind of sell it to us. It's fine if you didn't discover it till fourth year. That's unfortunate, but what have you done since finding this calling to really prove your passion and show commitment to the specialty? Like you said, Tampa is a wonderful place to live and work. We, of course, want to train people that are able to practice in any environment all over the world. But we'd also like to train people that want to stay at BayCare and take care of the population that we serve for the long term as well. So certainly having connections and ties to the area is another thing that could, help sell it for us a little bit. We will be accepting students for standardized clerkship rotation starting in April of this year, hoping to be up on VSAS soon. But in the interim, if anybody is interested in setting up a rotation, you can absolutely feel free to just email me and I will get you in contact with the right people to get that set up while we're waiting for VSAS to be live.
Yeah, for sure. Even on the I'll post this video to YouTube later, and I can even post it in the caption. Like if you wanted a little blurb or the email for the person to reach out to, I can place that
Oh,
there.
absolutely.
And then before we finish, what is one final message that you want students to take away from your program?
Yeah, I think, gosh, there's so many things that excite me about this program. One that we didn't really talk about yet, but probably was the biggest selling point for me and what really attracted me to BayCare is that this is a nonprofit hospital system and a small democratic physician-owned group. So all of the core faculty members are partners in this group that are vested. They have a vested interest in the success of this program and providing the highest quality care for our patients. And there's no, corporate businessman sitting somewhere or private equity chiming in and having a say in what we do. So we really are focused on providing the highest quality care for our patients and the highest quality education for our learners. And that is something that's so cool to me. I come in and I work with people that have been a part of this group for 30 plus years. They're still working because they love it so much and they're so passionate about it. And I've just never, in my career, I've never really experienced that level of commitment and love and passion for the job. So that's something that's kind of excited me about it, and it reignited my passion as well.
Yeah, for sure. It's something great for students to keep an eye out for. Like you're saying, it's important to have that passion to come to work to every day and have, like you're saying, a group of other physicians around you that are so passionate about the program is definitely going to be something super enticing for students as they look at it.
Yeah, I think
So
that's something I would challenge them when they do come. You're going to see that people genuinely care. It's not a front. I'm actually excited, just sitting here talking about this, and that goes for the entire core and clinical faculty that they'll get to work with every day.
yeah, for sure. And we'll make sure to link the Instagram for your program so people can look at that after the video if they have any more questions and see a little bit more about the program. But thank you so much, Dr. Gui. If you have anything else you'd like to say, if not, I will be ending the interview now.
No, thank you so much. Very excited to do this for the FSEP MSc. I guess one final plug is come to Symposium by the Sea, July 31st
Yes,
through
yes.
August 3rd. So would love to see as many students there as possible. And please let me know if I can help in any capacity in that way as well.
All right. Thank you so much.
Have a great one.